information into the incident collection system, you can hit a button and a automatic executive summary will pop out. It was very important, and I think most people recognize that when something is breaking or something developing, there's an upper level of management that doesn't want to know the in-the-weeds details. They want to know the generalities. So this incident management automatic executive summary creates that on the fly. One last point I should mention that Hippocrates is compatible with mobile devices as far as data collection, and there's other development as far as incident management that is being looked at right now on mobile devices. So some of the program facts, with the exception of programs such as Oracle, Java, and as mentioned before, Esri's GIS server, the software is New Jersey owned, so it is not a vendor-owned software, and consequently, there's a lot of flexibility in development and being able to change it very quickly. Over the course of the 8 years of development, we've probably invested about $9 million into it. The core capability cost approximately $3 million, and the rest has been enhancements and additional capability over the original core capability. It currently supports, as I mentioned before, health emergency preparedness and response in New Jersey. We have had numerous requests from others. However, we have not moved into that realm because the infrastructure, which is defined as the staff, the network redundancy, the help desk, and the policy is not in place. It is not a software restriction. It has more to do with the ability to support an organization outside of New Jersey that has currently prevented any users outside of New Jersey. However, I will show you a case study of a pilot we conducted with New York City OEM. It's currently, the software is currently continuing under development. It is dependent right now on federal health preparedness funding, and as all might expect, as that funding decreases, there will probably be less money available for increased spending on the software. Next slide, please. So current users include those on the screen, and I won't read them to you except to, again, reinforce that the software already is a public-private and NGO partner software tool. And I should also mention New Jersey Health does not charge anyone to log on or use the system. Next slide, please. So let me just quickly go over a cross-state information brokerage sharing pilot that we conducted with New York City, and we defined as New Jersey Department of Health and Senior Services, and New York City OEM and their EMS from FDNY, in which during the Red Bull air races on the Hudson River, the organizations agreed to try using Hippocrates as an information sharing tool. EMS from FDNY, Jersey City Medical Center, New Jersey's Health Command Center all logged onto the system, shared information, and demonstrated that that we could, in fact, with the right policy and with the correct oversight, use the information to watch incident tracking, EMS positions and status, command post locations, and hospital information. Next slide, please. And just a quick look at the slide, at a picture of what was presented. And if you can see the two little hands, one right under Liberty State Park, and the other right on to the right of the East River, which is New York City's OEM. You can see that those two command centers, the hands demonstrate we're sharing information between the two of them. And we view that as a good first step, proof of concept. And time for another poll.
Is this the, do you see a need for KMIB?
I think this is, would you be interested in?
Okay, thank you.
Okay, so 75% say yes, they would be interested in access. Nobody said no, and 25% aren't sure. Okay, so this comes to the heart of the matter, and of course New Jersey has developed their system, others have developed other systems, but I think the key here is as we look at regionalization, we look at cross-state sharing, we look at cross-sector sharing, we and I'm preaching to the choir, obviously, that everybody believes that there needs to be a way to share information when necessary and to do it without strain under what would probably be a strenuous situation. So the vision is to create some sort of national capability that allows for information sharing, that allows for fusion, that allows for knowledge management and information brokerage, and as we mentioned before, to use existing systems as to developing a new system. And I won't read up what's on the slide. The slides will be available in the future, but this just gives the general feel for where we're going. So, a national private public sector knowledge management and information brokerage system would on a daily basis provide all sectors daily situational knowledge. And again, we're talking about information and knowledge that is not at the classified level. It would be across the entirety of the Homeland Security enterprise, and it would be the look of Homeland Security incidents of relevance. Again, the term relevance indicating that this is an information brokerage system, not just a blast out of everything that's going on. There currently exists no capability across fusion centers to do this, so it's a linkage of fusion centers along with other sectors. Some of the things we're looking at in New Jersey at our Office of Homeland Security is particularly the ability to daily monitor critical infrastructure facilities. Incident displays, not to replace emergency management, but to look at those incidents that might in fact not rise to something that would occur as an emergency management addition. But if you're looking at Homeland Security and trying to blend information and paint a picture, may be significant. We're looking at the bringing in of businesses together and for BEOCs, Business Emergency Operations Center, to be able to talk to each other. And we're also looking at biowatch systems, and we do have some pilots going on between New Jersey and some other states as far as using Hippocrates for biowatch. And also the use of Hippocrates as an exercise program. And another poll. So 17% said that they use D-Team, 61% indicate they're using WebEOC, and 22% are indicating another Homeland Security software product. So the question is, how does what is being presented here different from the Homeland Security Information Network of DHS? And one of the key components is that this would be something that is owned, operated, and probably managed by, well, not probably, but managed by a public-private partnership to enable equal say among users of the system. It integrates existing partner systems that already are in existence, and it's got advanced knowledge and information brokerage tools that probably supersede those that might be available from PISM. It allows for user-created data collection and display, and there's advanced visualization. And it's not just a portal. PISM would, in fact, be part of this greater system. So if we look at all those IT systems that are out there, we look at what's out there, we see that in the cosmos of knowledge, there's the internet, which moves information back and forth. You have isolated software programs or non-integrated silos, and these are sometimes black holes you don't even know they exist. There are information grids being created by public health, being created by Homeland Security, being created by business, all independent, not necessarily created. And then, of course, the big terminology now is the cloud, and that's out there too. So the question is, how do you bring all of that together? And just hit the button, please, Laura. The idea is that Hippocrates could be this higher-level architecture, and when we talk about a higher-level architecture, we're talking about the capability to bring together all of these separate systems that might not necessarily be talking to each other right now, or have the capability of talking to each other. So bringing it together, you might see, and if you just hit the buttons, Laura, you would see incident events, support to incident command system, mapping, operational resources, communication, and the last one should be information, one more, analysis. And critical is the active and passive information sharing based on the ability to, again, knowledge manage and information brokerage As an example, this is a critical infrastructure module that we're considering in New Jersey, and if you look at the idea of adding information in during an event, and Laura just hit the button again, and the idea that an incident could take place, or an incident has taken place, it was entered in the previous screen, it pops up on the screen, next slide, and these are old screenshots of Hippocrates, not the newer version. We currently have in Hippocrates a hospital divert module, and what you see here is a variation on that module. Instead of entering hospital status, we've entered critical infrastructure status. And if you hit the button one more time, you'll see that when the status is all blended together, what would come out to the end user is a critical infrastructure that has indicated that it has a situation, and the other critical infrastructures that are either encompassed or affected by that information, visually depicted and available to all users. We are, again, looking at building that module in New Jersey right now, but this is an idea of how the public-private sector could be looking at incidents and bringing that information together. One more example on the next slide. And this next scenario is based on a situation that actually occurred, and the history was that New Jersey was affected by approximately 9 white powder incidents that were mailed to local banks. The first one popped up, and unfortunately, a lot of white powder incidents occurred. Colorado actually got the same letter. However, at the time, neither New Jersey nor Colorado knew that the other had got. So with the way the system is built, the local incident could be promoted to a state incident. Another white powder incident occurred in New Jersey. We're starting to go from an incident to an event. In the worst case scenario, a nearby hospital would go on divert, again depicted by the Hippocrates, as checking on the bed status for the hospitals in the area of interest to those who were monitoring the situation. We could look at a regional basis and also totally for New Jersey itself. Colorado and New Jersey could agree to share information, either on a national server, and I should mention that this could all be done on one server with the common picture presented there. This is all capable right now. This isn't something that needs to be developed. The software allows for this presentation right now, and also would be able to show all the hospitals that are in divert across the country. Again, with data entry, the system software is built to be able to display this, giving the idea of, for example, Region 3 bed status in the areas that are affected. One more visualization. Hippocrates does have the ability to display nationally all of the symbols that are, all the situations that are depicted here. This would be a depiction of Hippocrates if it had been used during Haiti, and the ability to come up with that common operating picture automatically just by hitting the executive summary button. And we have another poll here. Okay, so 90% said yes, 0% said no, and 10% are uncertain. So moving forward, the All Hazards Consortium, by nature of its organization and its partners, has the means to examine this initiative in support of a public-private Homeland Security information sharing project. We're looking for volunteers to participate, somewhere along the lines of 5 public partners, NGOs, 2 NGOs, 5 states or local agencies, a DO organization, and federal partners.